In Whitehorse, there was another candidates forum last night, this one hosted by the Council of Yukon First Nations and the Assembly of First Nations Yukon. It focused on Yukon First Nations issues. There was time for audience questions, and one question was requested multiple times. Here's how the exchange unfolded.
The opioid crisis is severely impacting the Yukon, with several communities under a state of emergency due to overwhelming numbers of overdose and death. What would your party do? What would you and your party do to address this persistent issue? And again, we're going to start with Gabrielle Dupont. Go ahead, Gabrielle.
So we already have many tools in our toolbox, but if there is one thing that we can certainly improve is to make sure that we do have enough treatment for everyone, and enough treatment spot, bed for everyone, and make sure we do have the funding to increase our capacity. And another important point on treatment is that we do need to make sure that treatment is available in communities, because this is where people have their support network, and we already know that people are quite vulnerable, and this is a very bad idea to either concentrate them in Whitehorse or anywhere else. And so let's work on getting more treatment in communities, and this could be healing camp, healing center, but
Thank you.
treatment.
Thank you. We will go next to Catherine McCallum. Go ahead, Catherine.
Thank you. I would like to recognize the over 100 Yukoners that we have lost to the toxic drug crisis since it began in 2016. I know that this crisis continues to impact the lives of so many Yukoners and has spread grief and loss across the territory. These people were loved, their lives were meaningful, and each of them is deeply missed. People who use drugs deserve compassion, dignity, and equitable access to health care and supports. That means providing access to free, high-quality, culturally safe, evidence-based treatments for everyone when they are ready, increasing access to detox services so people are not turned away, providing aftercare supports and sober housing to people leaving treatment, increasing mental health supports, getting people out of shelters and into homes, increasing supports for people who are currently using drugs, protecting supervised consumption sites, safe supply, and other harm reduction efforts from cuts. These services provide care, community, and dignity, and they save lives.
Thank you. We will go next to Ryan Leaf. Go ahead, Ryan.
When we hear about the numbers of Yukoners that are dying to the opioid crisis, in particular in a specified time period, we have to ask ourselves what has changed. What's changed is an affordability crisis that's driven Yukoners into despair and depression. It's exacerbated mental health challenges. It's exacerbated people's stress levels and their outreach for the substance abuse that has tremendous impact on the smallest of our communities. It is out of control. Our government's going to commit to making available 50,000 spaces for treatment. Compassion is bringing Yukoners home, treating them, helping them through culturally appropriate, Yukon-guided solutions. But there's another equation to this, and it's enforcement. There are people bringing these drugs into our territory. Our cities are changing dramatically, and we need to put an end to the people bringing the drugs into Yukon communities.
Thank you. And then we'll go next to Brendan Henley. Go ahead, Brendan.
Thank you. This is a crisis that I've been involved in my previous role as CMOH since 2016, and things have become worse through the pandemic and its after effects. People are grieving, First Nations are disproportionately affected, and communities are disproportionately affected. We need to continue prevention, harm reduction, treatment, and enforcement. What I'm hearing from the communities is a need for more capacity for land-based healing, better aftercare and access to aftercare, Rural harm reduction needs to be scaled up. Clinical support and clinical treatment, especially for rural Yukon, needs to be stepped up. We nationally, and I have been an advocate for this, are not meeting the scale of the need, and we need to scale up federally. And this is where we need to have the conversation. Each community also needs to be supported because each community has a different approach and needs a different approach.